As we all know, diabetes mellitus is one of the leading diseases worldwide, and around 70 million of Indian population is suffering from diabetes mellitus. Diabetes mellitus can affect all organs including eye. So diabetic retinopathy is one of the serious complication which needs to be addressed. So what is diabetic retinopathy? So retina is the important structure of our eye which is very important for our vision. So if there is any problem in our retina, it can affect your vision. So diabetic retinopathy can affect your vision. So around 35% of diabetic population has having some sort of diabetic retinopathy, of which around 11% of population is having some vision threatening complications. So diabetic retinopathy, most of the time it is asymptomatic. So you will not have any symptoms unless you consult a retina specialist, say they dilate and check your retina, then only we can diagnose your diabetic retinopathy. Only in your advanced diabetic retinopathy you will have a vision problems. So we cannot wait till that advanced stage. That is why the screening is important. So if you are diagnosed to have a diabetic mellitus, the screening has to be done once in a year. Even if you are asymptomatic, the screening of retina has to be done once in a year. If you have any symptoms, you have to immediately report to a retina specialist. So how do diabetic retinopathy presents? So it can present with a defective vision, or it can present with a sudden loss of vision, or it can present with a poor quality of vision, or it can present with some black spots. So when do we treat diabetic retinopathy? For early stage, we keep the patients under close observation. Only when it crosses advanced stages, the patient needs treatment. So what are all the treatment modalities available? We have laser therapies, we have intravitreal injections, and we have vitrectomy surgeries. So which patient requires which mode of treatment? For that we need to investigate the patient. So we need to do OCT examination. If needed, we need to do fundus fluorescent angiography, and if needed, the patient requires ultrasound examination. So the proliferative diabetic retinopathy patients will require laser therapy, whereas diabetic macular edema patients requires intravitreal injections, whereas advanced proliferative diabetic retinopathy with vitreous hemorrhage and tractional detachments will require vitrectomy surgeries. So diabetic retinopathy treatment is not one-time go treatment. Once when you are diagnosed to have diabetic retinopathy, you need to come for lifelong follow-up. That is most important, and you need to keep your sugar under control. If your sugar is not under control, you might require repeated treatment. So the keeping your systemic status, that is if you are having an additional hypertension, cholesterol, all the systemic factors under control is very important for treating your diabetic retinopathy.